Hello, my name is Ravi Vij. I'm from My Cancer Haven, and welcome again to one of our video podcasts. And today we're going to talk about how I approach frontline treatment of fit AML patients. And for this, I have with me Dr. Manuel Espinoza, who's Assistant Professor of Medicine in the Division of Hematology and Oncology at the University of Alabama at Birmingham, to guide us through this topic. Welcome, Manuel. Glad to have you here.
Yes, thank you, Ravi. Appreciate the opportunity.
So, as far as acute myeloid leukemia goes, obviously, it is a disease that affects generally an older population, but we see people from all age groups in this disease. So, how do you approach your initial, treatment algorithm? How do you decide which path to go down?
Yes, of course. So, like you said, you have in the slide there, I think one of the main the first sort of classifications we do when we approach a patient that we suspect has newly diagnosed AML is we looked at the patient's comorbidity, functional status, basically just to put it bluntly, how sick they are and how sick they were before they came down with leukemia. Sometimes somebody can look pretty sick and we can sort of chalk all that up to the leukemia, but otherwise their organs are okay. So that sort of grossly divides people in these fit and frail categories. An easy way to discern, to classify is by going by age. Some people will say definitely everybody older than 70 would probably fall in the frail category, but depending on the person, some people older than 65, older than 60, and even younger can fall on the frail category, depending on if they had any significant, let's say, cardiac disease, hepatic disease, renal disease before they came down with leukemia. Another thing, like I said, to keep in mind is that some of their, when we first meet them, they have uncontrolled leukemia. So some of their symptoms and some of their sort of abnormalities could be related directly to that and not to underlying comorbidities. So it is important to ask them, what